I want to thank Professor Cittadini for the honor of speaking in this section. I'm really honored to speak after such speaker that during these days have spoken about all the story of human-assisted reproduction, and in this section speaking about fertility preservation. I'm working for the National Health Institute, and actually I'm director of the National Heart Register. For this reason, I'm collecting data also on this issue of fertility preservation. In Italy, those techniques just began many years ago in few academic centers. There were Professor Cittadini working in a university hospital, Policlinico Sant'Orsa of Bologna, working in this field with Professoressa Fabbri, doing a lot in ovarian tissue cryopreservations. And then after that, when the National Register of Assisted Reproduction was established in 2005, as soon as we want to collect more data also on those techniques, we make a survey just wanting to discover which was the situation in Italy, because we know that there are different realities and we want to discover how it was the situation. This is the situation of the art centers in general. Our centers in Italy and especially in Sicily. And this is the centers divided, which are publics and which are publics are covered by our national health systems and the private ones. That means that in Italy there are a lot also of private centers, but the vast majority of our procedures are covered by our national systems. And then you will see afterwards that also those techniques of fertility preservation are covered by our national systems, but it depends on, there are variations regions by regions, actually. So these are the cycles made for assisted reproduction, and we came to our survey. Our survey was to discover which was the situation, and this survey is just dedicated to the art centers. So they didn't include the bank semen or the other tissue banks that came later. So we asked the centers which were their facilities, which was the location, which kind of service do they offer, and then moreover we want to know which are the connections with the oncological units and if they have a service completely dedicated to those kind of patients. To the survey, these are the centers that replies to the surveys, not a big response, but that means that not all the centers perform those techniques, and that's a good thing, because, you know, when I've told that everybody from Romero, everybody has to be the one that make those techniques, I will be more cautious, because you know that we are a lot of people in Italy, a lot of gynecologists, and sometimes anyone want to perform those techniques, and it's better also, we are many, just to concentrate in few places the storage and then the techniques. So you see which is the situation in more details. It's not important, but just to show you that the vast majority, as soon as they are art centers, they perform cryopreservation, outside cryopreservation. You know that after the law, Italian research has been really pushed to cryopreserve outside because they cannot cryopreserve embryos. So everybody was, the vast majority is cryopreserving outside, and just a small amount of center perform both the techniques. These are again the centers divided for the one that perform treatments in cancer patients. I had a tissue bank in Lazio region because it has been created many years ago, and finally, since 1 year apart, they begin their activity. So I just keep on very quickly. You see, region by region, we are asking how many patients on how many patients did you perform those techniques, oocyte or ovarian tissue cryopreservation or semen cryopreservation. The main centers you will see at the end are 3, and one is the one from Turin in Piemonte. This is the situation in Lombardia. This is the situation in Friuli, in Genoa with Dr. Anserini. And then again, as I told you, in Bologna there is Professoressa Fabbri that makes the ovarian tissue cryopreservation, and Professoressa Porco that made the oocyte cryopreservation. Dr. La Sala is here with Reggio Emilia and other facilities. Then again, skipping, in Tuscany there are many, and it depends on the regional health policy, because till now, also if we are really hoping that the situation will change suddenly, will change in the future, we will never know. During this week we will discover more. But till now, the difficulties of Italy is that there are still regional health services that make a lot of differences, also in the possibility to achieve treatments from one region to another one. So again, the Campania region, for instance, has made big progress just because they can apply to some funding from not the Ministry of Health, or Presidenza del Consiglio, so from the government, and they improve 2 centers start to do those techniques. They are just collaborating, University of Naples collaborating with Professor Andersen from Denmark, just to start in the future. So again, that's the situation. Unfortunately, you see, there are also some realities that begin. This was 2 years ago or 3 years ago, and then they closed the activity because there are no more funding, so they stop. Again, this is the situation. For Sicily, you see that Professor Cittadini was the one that began for the first one, that continued this kind of activity, also if it's not in the public anymore. And then again, the University of Sardinia. So at the moment, this is the situation. There are these 59 art centers in 16 regions. These are the number of patients that has cryopreserved oocyte. These are the number of oocyte cryopreserved. That means a mean of 8.6 oocyte that, as you already know, are too few. That will depend from many things that you already mentioned, that probably the indications for treatments are a little bit too large at the moment in Italy, because also patients' associations are very, very pushing, telling not us, but to the centers that perform those techniques, that is very important for the patient also, if he's a little bit older, just to have this hope for the future that she will face the therapies better if she knows that has this hope for the future. And then there are 12 centers dedicated to this activity. You see with the different colors, the regions in the north, like Lombardia, Tuscany, but then also Sicily has a number of cycles for fertility preservation for sperm, then again for fertility preservation for oocyte cryopreservation, and then for ovarian tissue cryopreservation, the numbers are changing. Let me say that also Sant'Orsola Malpighi, they have a lot of store samples from patients, but they belong also to the 90s, and we have tried hardly to recruit all the data from those centers just to make a survey, more detailed survey with some data, but it's impossible because part of this data are just written in the, it's impossible to do. We have tried hardly. Let's say that there are not computerized data, so it is impossible to follow the story. The only possibility that we have, and we really hope, as soon as we are ready, since 2 years apart, to make a national data collection, a prospective data collection. So year by year, we have to collect data with indications, proper indications, all the categories. When the colleagues from Spain were speaking, I said, oh, why don't we can stay at the same level? Also because we are ready to do so. We have a software dedicated. We are all the forms ready. It's just a problem in Italy, bureaucratic practice, and politicians want us to go very slowly. Very slowly, and if you make one step beyond, they just push you in another direction. I don't know why, because many times we are ready to start with something and we have to wait. So these are the Italian centers that perform both the techniques, oocyte cryopreservation plus ovarian tissue cryopreservation. I put it in in green all the public centers. There are university centers or hospitals, big hospitals. And then these are the ones that actually have patients, have treated patients. You see Torino, Bologna, Palermo, and Sassari. The number of patients are bigger for ovarian tissue cryopreservation. These are always the same indication. That I want to skip this because they are mainly the one that you mentioned before. A lot of breast cancer, oncohematological disease, and other cancer, and so on for the biggest centers. And these are the centers that reply us, and we check those centers that they have a dedicated unit. It means that they can really offer all the techniques to the women, and then they just reply in very, very short time to any demand from the oncologist. And they work in strict collaboration with the oncologist, with a multidisciplinary team, just to give the global care to the oncologic patients. So this is the situation at the moment. Also, if I know that there are other centers that still doesn't give me data but are ready to start or have already started. For instance, speaking with a colleague yesterday evening, I discovered that in Pavia, near Milano, Professor Nappi just began. I've told her to give us the data, but they are not yet. For this reason, it's very, very important when we will establish a national data collection. It would be not a voluntary thing that I send letters, I send emails, somebody reply, somebody doesn't say the truth. So it is quite hard if you don't have a proper data collection. So the Italian law has changed, allows the possibility to give therapy also to these patients. Also, if I already told you that sometimes, for instance, in some, it depends also not from region to region, but even in the same region from one hospital to the other university, if they can keep, for instance, the gamete storage for free or not, it depends on the policy of the place. Now again, as soon as the government has been sensibilized on this matter, they have created the particular pathway, therapeutic path care for fertility preservation in cancer patients. They should be active, I don't know when, because they say they will be shortly active, but then as soon as the government has recently changed, we will know that in the future. Unfortunately. I've told you that the patient association, cancer patient associations are very active in this field, and they've asked us many, many times. We collaborate with them in performing courses to diffuse the knowledge of fertility preservation, to involve more oncologists, to make the proper counseling. And they say that what the patients want, they want interventions, and the motivation for that is that they need information. They want to know which are the centers performing those techniques, which are the specialists. And there are a list of specialists for men because it's easier. Just 10 years ago, there was the list of all the centers that perform sperm collection and sperm cryopreservation, but we are not allowed till now to publish our data for the Ministry of Health. They keep secret on that, and they say, wait, as soon as when we will have those pathways, it will be ready, but it's too late for patients. Okay, we have made a lot of research projects, a lot of courses in many Italian regions, and moreover the HESHRE groups, and with Françoise Schenfield, we have done those studies to discover which was the situation in different countries in Europe, and we discovered that the situation is more or less the same from the legal background. Nobody is offering social, let's say, you cannot say social freezing, but let's say social freezing just to understand that nobody is paying for that, just for medical reason, and mainly in many European countries it is allowed. So these are the data for the last, from 2010 to 2014 for Italy and all the other countries for both. This is our website, and I take just 2 minutes more, just because in this Congress I've seen that it is a Congress of memories and it's also a Congress of storytelling, so I want 3 minutes to tell also my story. I'm just working in this field since 20 years apart, but one of the main reasons why I'm doing my work with passion, and I will stand here like Leonard Cohen, I'm your woman, I'm not your woman, but I'm your woman, because I have to face infertility in my life, and as soon as you see, this is the Italian register, and on the first leaflet on the Italian register, you see those faces. Those belongs to me, and I've asked the permission to do that, and I want to thank you all for these results. That is my triplets, Caterina, Giovanni, and Isabella. They are 22 years old now, and thanks to you and to all the people working in the reproductive field, they are here, they are happy to be here, and they say, Mommy, don't do it, please don't do it. They say, you are somewhere else, it's my Congress, so okay, so they say yes at the end. And sorry for that. And then these are my collaborators of the National Register, and thank you for your attention, and for any further information you can visit my website. Thank you.